going to lead to a major shift in economic thinking and practice, I think.
Tofi, just on that, you've been writing about Ghana's response to the crisis and the ways in which it has managed to tackle the crisis using a smart variation of testing. Tell us a little bit about how that's working in Ghana, and then in Nigeria, there does seem to be just as across the continent, there are different ways this pandemic is being handled. Nigeria being a continent, there does seem to be very different ways in Nigeria that this pandemic is being tackled. So I've gone and given you two big questions at once, but take them one by one.
Okay, so just to start with Ghana. So Ghana has seemed to be kind of ahead of the curve in West Africa anyway, on fighting the pandemic. So they took a very proactive proactive manner at going about it. So all stakeholders, so they brought together the political, religious, traditional and civil society leaders together with the government to fight it. So the response has been very coordinated on all levels of leadership. And on a per capita basis, Ghana has produced the best testing results in Africa. So what they did was when they recognized how the virus had come into Ghana through a traveler, they recognized the parts of the country that were that had been infected, and it was Accra and Kumasi were the two main centers, and they were shut down or shut off from the rest of the country in order to try and contain the virus within these cities. And then it was very closely watched how the virus was traveling around in these cities, the parts of the cities where most people were contracting the virus. And when they did understand this, the restrictions were slowly eased, even though, they still can't have public gatherings, schools are still closed, and things like that. But by containing it very quickly, they were able to make sure it didn't spread all through Ghana like it is in other countries in West Africa. So I think that's what they have done really well. And although their public health system is weak, as a lot of public health systems in Africa, they are one of the best in West Africa because of the developed health insurance scheme. So they were able, even from the beginning, to handle it better than countries with weaker public health systems. And going on to Nigeria, so it hasn't been as coordinated a response. So for example, in Kaduna State, Governor El-Rufai has kind of done a different thing from the rest of the country, which has actually seemed to be working quite well. So Kaduna was actually the first state to announce lockdown, and this was before the federal government announced it for Lagos, the Federal Capital Territory, and Ogun states, which had the most cases. They locked down on the 25th of March for 30 days. And then they have extended it for a further 30 days. And this lockdown prevented people from the states with the large amount of cases from coming into Kaduna. And to date, the state only has 92 cases and 1 death, which is quite a good result, considering that they did, the governor himself was the first case in Kaduna, and he got it relatively early. So in Kaduna, 500 million naira of government funds were used to buy food and necessities for the 9 poorest urban local governments, and they were spread out. They've done things like, for example, the main markets have been shut down and smaller markets have been opened in neighborhoods, so people don't have to travel as wide. With schooling, because they don't have very wide internet or statewide 3G, the senior secondary school students who have to take their exams soon have been taking lessons via the radio, which would be quite a good idea for the rest of the country because the internet isn't widespread in any state, I would say. So it seems that they've kind of gone in a different direction from the federal government, and it seems that it is working for them. The health system in the north of Nigeria is even worse than in the southern part, so they've recognized that they have to be very careful and make sure that what's happening in neighboring Kano, for example, doesn't happen to them, because in Kano there's been masses of deaths, masses of cases, and the state is really struggling to handle it, and their public health system is just not equipped to handle any sort of mass movement of ill people. So,
any other states showing leadership in this pandemic?
I think Lagos has been, I mean, in Lagos, there's kind of a debate as to how well we are handling it. There has been some government initiative to give food to the poorest people so that they're not too badly affected. But honestly, it doesn't seem that many people have gotten these subsidy packages. I know in Lagos and Federal Capital Territory, a lot of private companies are coming together to raise money and go and distribute food packages themselves. This was happening even during the lockdown, though, which obviously means that there wasn't social distancing, but at the same time, people have to eat. We can't expect people to sort of stay at home and obey all the lockdown rules if they have no food to feed their families. So I think that Lagos has done relatively well, but it is a very, very overpopulated state. So I guess that's why they haven't been able to spread the subsidy packages as widely. But I would say Kaduna has probably seemed to have been the most proactive and done the best.
I just wanted to find out to what extent there was in South Africa this pushback against lockdowns, against really having to confront this disease head on. There's been huge amount of memes on social media about 95% of people survive. So why is there such a big noise being made about this pandemic? Is there are there vocal parts of society in South Africa who are angry that the economy is shut down and just want to get back as quickly as possible?
Yes, Nicholas, the booze brigade, especially the alcohol producers, lobbies, they're not happy because lockdown comes with the outright ban of the sale of alcoholic products. So, they're feeling the pinch quite substantially. They've tried hard to lobby without much success. The cigarette lobby as well, they've tried, they've failed as well. Government is digging in its heels. There's a curious case of the Western Cape. As you would know, it's the only province in the country, out of our 9 provinces, that's governed by an opposition party, the DA. It's not an ANC control. And there we're seeing people quite outrightly trying to flout some of the regulations, saying that they're too draconian. But ironically, the Western Cape has overtaken Gauteng, or the broader Gauteng region, as the number 1 spot in the country where the COVID curve is on an upward trajectory. The Western Cape at last count had almost 4,000 cases. In contrast, Gauteng, where Johannesburg is situated, has almost 2,000 cases. And the curve here in Johannesburg doesn't seem to be on a steep incline as it is, in places like Cape Town and the broader Western Cape region. There are also grumbles, from the business sector. People are feeling the pinch. They're saying that the economy should be opened up much more, quicker than it is being done at the moment by government. But the reality of the matter is that, we're dealing with a public healthcare pandemic. We've had several hospitals where they've been declared COVID-19 hotspots here in Johannesburg, as well as in KwaZulu-Natal as well. And the unfortunate reality is that, public life has to take precedence over the economy in some segments. In addition, Nicholas, our receiver of revenue has given an update, to say that they're feeling also the effects of COVID-19 in terms of collections. Their projections are, for quite substantial revenue shortfalls, both from, corporate income tax as well as personal income tax, because first of all, people are being retrenched. There's no revenue coming in for companies, so they're retrenching staff, and they're also unable, to pay their dues to the taxman in the country. Interestingly enough, the duties that they normally get from cigarettes and alcohol, they've given them a substantial hole, to fill as the receiver of revenue. Overall, there is a sense of complacency, I would say. Initially in March, there was a sense of urgency. that this had to be done for the national good. But as the months roll by and time goes by and people are starting to feel the pinch, personally, there is a sense of restlessness in the country.
My producers just whispered in my ear about some new research by the Human Sciences Research Council, which indicates that around a third of South Africans are currently going to bed hungry, 45% in the townships and informal settlements, 9% in the suburbs. That sounds like an incredibly explosive number. How's that playing out at the moment?
So the government, I think I wrote this 2 weeks ago, recognized that hunger was going to be a huge challenge for people, and that might lead, to some sort of social upheaval and people flouting the lockdown regulations. So what they've come up with is a strategy to feed the hungry and go door to door via our social development department, as well as our social grants agency, which is SASA. So they're giving people food vouchers. They're exploring that. They're also giving people food packages. But unfortunately, we're bedeviled by corruption in this country, and some of the councillors who've been given the responsibility to distribute these food parcels in their communities, have kind of taken the opportunity to feather their own nests and to benefit their own patronage networks instead of the broader community. So that's also a big challenge for the country. And in addition to that, people have a sense of this is an invisible pandemic. It's not necessarily something that you see, you hear. So there's a general sense of suspicion as to whether or not it's serious for the country to be in lockdown for such an extended period.
Thanks very much, Chris. I cannot let you go, Patrick, without asking you about Tony Allen, who you've been privileged to see in the flesh on many times in these last few decades. You wrote a lovely obituary to him a few days ago. There's been a huge outpouring of love for the man, and also we've said goodbye to a fair few greats, Congolese singers. Right. Manu Dibango left us. It's been quite a moment.
I think it has, and the outpouring of love, as you say, for particularly Manu Dibango and Tony Allen says something about the connected world. And I think it's connected world in a way, and globalization that's brought us this pandemic and our inability to deal with it. But it also has, on the upside, it's brought us together. So you've got the presence of these brilliant African musicians like Tony and Manu Dibango touring the world, contributing to the music scene in Paris over, in Tony's case, over 30 years, and Manu's case actually probably over 40, 50 years. They've become fixtures on the Paris scene. And of course, it was horrible news last Thursday when we heard that Tony had died, not directly of the virus, but of a heart attack. And it's rather typical of a lot of cases where people have been reluctant to go to hospital with other medical conditions, simply because the hospitals are jammed with dealing with people with the virus. And it seems that Manu Dibango's own case, he actually caught the virus and died from respiratory problems proceeding from that. But I think just on this, the outpouring of solidarity with African musicians, you've seen it with the Senegalese musicians, Ugandan musicians, Nigerian and Ghanaian musicians, all clubbing together, putting out songs to mobilize the communities to fight the pandemic. And last week, actually, kind of with sort of rather cruel timing, the International Jazz Festival, which was due to hold in South Africa, in Cape Town, in fact, in April, they did a virtual International Jazz Festival. So you had some of the, you know, the stalwarts of South